All right, so today I'm going to show you how to transfer a patient that had just had spinal surgery. This patient in particular is a T1 to T12 fusion. So their weight bearing is tolerated through the lower extremities, but you have all the spinal precautions. So no bending, no lifting, and no twisting. And we're trying to transfer them from bed to the chair. So first you want to make sure you have everything squared away. So you want your gait belt for when you sit the patient up. You want your wheelchair with the wheel locks engaged so it doesn't move. And yeah, so we can start. First, since this patient is a little taller, we're gonna have to move this a little bit out so the legs don't hit so the legs of the patient don't hit the wheelchair. And then we can move it back when we're ready, okay? All right, so to begin, we're gonna put the patient into a log roll. So to promote that no twisting, no bending. So we're gonna have the patient bring his arm over like this and have his arm like this. We're gonna have this knee up. We're gonna have this knee up as well. So as you do this, you're gonna wanna help roll the patient over. All right, so he's gonna have one hand right here and he's gonna have this hand right here. As he goes up, he's gonna push down with his left hand and help with this right arm as well to help, and I'll be there keeping his spine in line as well. So we're gonna start, okay? So 3, 2, 1. All right. And we're gonna move the legs over like this, and we're gonna scoot you up, okay? There you go. Let's get your feet touching the ground. You want to make sure the patient's feet are touching the ground, okay? Now they have a good support. They are able to hold themselves up in this situation, so you don't necessarily need to keep your hand on them, but it is nice just in case. And so we're gonna don a gait belt. So we're gonna reach around. And when donning this gait belt, since it is a big incision, you can still put the gait belt on and not hurt the incision as well. So you're gonna wanna make sure this is tight. Is that tight enough?
Yeah.
Not too much pain right there? All right. So there is extra. You wanna make sure to tuck that away so it's not in the patient's way. All right, and so you'll bring the wheelchair over, you'll lock the wheels. You'll make sure the wheelchair is at like a 30-degree angle, somewhere around there. And so as you start helping the patient up, we're gonna do a stand pivot, but a variation of that. Since there is no pivoting in the back, since you can't like twist with your back, we're gonna do a variation where you just take a couple steps and turn, and then we'll have them sit down, okay? There we go. All right. So I'm gonna do an anterior knee block to help him up, just in case he does need the help. And you can grab onto my shoulders if you need it. So we'll lift on 3, okay? 1, 2, 3. All right. So let's take a couple steps to there. Keep going, and back up. All right, and let's sit down slowly. There we go. And you want to make sure the patient all the way back, hips all the way back in the wheelchair. And that's it.